From your vantage point, how are distribution efforts going so far? What have been the victories? What have been the hiccups?
Yeah, I mean, let me just start by saying that this is historic in the type of mobilization that's been required. We have not seen something like this in public health before. We're talking about delivering billions and billions of doses around the world. Just in the U.S. alone, we now need to deliver these vaccines to 21 million healthcare workers. And really, planning has been underway now for months with complex logistics, ultra cold storage, all of the partnerships that are required. So I am actually incredibly amazed how well this is working and how the public-private partnerships are really leading the way and collaborating. From what I'm seeing, I think the hiccups are more in the communications. We need to take a much broader stance on clear, transparent communication as this gets rolled out, so that we don't continue to have vaccine hesitancy. But from a mobilization effort, I am incredibly impressed with where we are.
So what is Salesforce's role in this distribution going to be?
Yeah, I mean, for us, since the onset of this pandemic, we saw a need to step up, just from everything from getting PPEs to hospitals. We saw that this was a significant challenge that was developing in the world from what we faced, in modern times, really. So what we did a few months ago is launch something called Work.com, and it's a platform that really, when we got started, offers technology for governments and organizations to have their employees manage their employees, right? Looking for PPE management, contact tracing, testing, back to work resources, emergency response, et cetera. But we now have expanded it over the last few weeks to a comprehensive vaccine management solution. It's a technology that several states have already started using, and it essentially allows for inventory management, administration, appointment scheduling, notifications, and really importantly, managing and monitoring outcomes. So we are providing a reliable, agile technology that countries, governments, organizations really can use flexibly to monitor how they are managing and delivering these vaccines.
Now, at the same time that this vaccine is just starting to be distributed, it feels like COVID is closer than ever. If you haven't gotten it already, someone close to you has. People are spending the holidays separated. There is a lot of fear out there. The vaccine is going to take time. There are so many people who want it now who can't get it right now. Teachers, for example, who are still working in schools. Quickly, it's not too late, is it?
It's not too late. I mean, the vaccines are definitely very important, but I think we need to recognize that we're a long ways to getting the entire world vaccinated, and that is really important to have equitable vaccination globally. Of course, we're going to start with the people that are taking care of the sick, or our frontline healthcare workers and the people in long-term nursing homes. And from what I am hearing, they are prioritizing for the next wave people that are critical, like teachers, so that we can get them vaccinated before we move on. But just getting vaccinated does not mean that you can move around without masks and social distancing. We really still need to maintain all of the things that we're doing so that we stop the spread of this pandemic while the rest of the world gets vaccinated.